Sweet. So I'm Davis, this is Will. We're presenting on cardiovascular disease. What is cardiovascular disease? Cardiovascular disease is a group of diseases that involve the heart and the blood vessels. A lot of people think it's just one or the other, or CVD is just one condition. No, it's actually a huge group of conditions that can lead to heart attack, chest pain, different arrhythmias, but it's pretty much anything that is induced because of lack of blood flow from the arteries.
So here we have common types of cardiovascular disease. On the left are vascular diseases, and these have to do with the arteries. And on the right are cardiac diseases. So these are the two main headings. Cardiac diseases obviously has to do with the heart. Vascular diseases, the first one is coronary artery disease. Then we have peripheral arterial disease, having to do with the peripheral. Then we have cerebrovascular disease. That has to do with the brain. And then we have renal artery stenosis, having to do with the kidneys. And our next heading here, cardiac diseases having to do with the heart. The first one, cardiovascular disease, is cardiomyopathy. Then we have hypertensive heart disease, which is high blood pressure. Then we have heart failure, so this is pretty much a heart attack there. And then we have pulmonary heart disease, cardiac dysarrhythmias, and rheumatic heart disease. And these are just a few of the vascular diseases and cardiac diseases. There are many more, but we couldn't fit them all on one slide.
Okay, so who does CVD affect? It affects anyone that's not living like an active, healthy lifestyle. So the first one, as you see here, people with high blood pressure, 13% of those CVD die because of high blood pressure. The next, tobacco, 9%, lack of exercise and diabetes at 6%, and obesity at 5%. And CVD can be caused by a lot of things, whether it's smoking, not eating right, not working out enough, drinking too much alcohol, having high blood pressure. There's just a lot of leading causes for it, but they're all very simple to abstain from.
Here we have some risk factors for cardiovascular disease. The first one being age. Obviously, the older you get, the more you are at risk of developing cardiovascular disease. And we have gender. If you are a male, you're also much more likely of developing cardiovascular disease. That's not good. Also, when females are done with menopause, they kind of get on the same level as males with their risk of developing cardiovascular disease. Also, tobacco use. If you use tobacco, you're much more at risk. Inactivity, so that's living a sedentary lifestyle, not exercising, you're at much more of a risk there as well. Excessive alcohol consumption, that's going to spike your blood pressure, get you to be hypertensive, and no good. It's no good for, you might develop cardiovascular disease. Diet plays a large role as well. You need to eat a balanced diet, depending on who you are, your body type, male or female. And if you don't have a good diet, you could definitely develop cardiovascular disease. Obesity, if you're obese, much more at risk there. Genetics plays a role as well. Mostly to do with immediate family members, but it definitely plays a role. Blood pressure, if you're hypertensive and your blood pressure's up, you're also at risk. And then cholesterol as well, dealing with artery blockage. If you have high cholesterol, total cholesterol, your risk of developing cardiovascular disease goes up.
Okay, so a lot of people don't know, but cardiovascular disease is the leading cause of death globally. So as you see here, over 17 million people in 2013 died of cardiovascular disease, whether that's a heart attack or a stroke or anything along those lines. It depends, but that's within CVD. And as you see in 1990, it was only 12 million people, roughly at 26%. So there's been a dramatic increase in the past 2 decades of CVD. And coronary artery disease and stroke account for 80% of CVD in males and only 75% in females. But overall, CAD and stroke are the leading causes within CVD.
So here's some ways to prevent